People have a lot of questions and some fear about joint replacement. So to learn a little bit more, we're going to play Myth versus Fact with Dr. Liebelt here. First one, joint replacements don't last a long time.
I would say that's a myth. We never know how long a joint replacement will last in an individual patient. There are no guarantees when doing surgery on a patient. However, we have been performing hip and knee replacements for over 50 years, and so there's a lot of data to look back. And in multiple studies, both for knee arthroplasty and hip arthroplasty, if you look at patients 20, 30, 35, 40 years after surgery, a significant number of patients are still functioning without pain and without having had a revision surgery.
Oh, okay. Orthopedic surgeons will discuss all care options, not just surgery.
I would say fact. Surgeons want to meet a patient and want to know why they're there. So what kind of pain are you experiencing? What kind of disruption in your lifestyle has that caused? Oftentimes the safest and easiest treatment for a problem is not surgery. And I don't think any surgeon wants to recommend surgery if a problem can be solved without it.
Okay. When recovering from joint replacement surgery, it's best to spend a lot of time in bed.
I would say myth. After surgery, it is important to rest and recuperate from surgery, and also control swelling, which often means spending time in bed and elevating your lower extremity. However, you want to get the joint moving, you want to get to therapy, you want to see your surgeon, and even hours after surgery, you're moving around in the surgery center or the hospital. And so I would say myth.
Okay. People can resume many of their physical activities after a joint replacement.
Fact. The whole reason we're doing the joint replacement is to get you back to the lifestyle that you felt you couldn't accomplish with the pain and dysfunction you had in your old joint.
Okay. And last one here, avoid joint replacement surgery if you're too young or too old.
Absolutely 100% a myth. Again, you should see a surgeon or an orthopedic provider if you are suffering from pain, stiffness, joint dysfunction that is disrupting your lifestyle. Traumatic injuries in the young can lead to joints that look like an older person's joint. And with good medical optimization and careful surgical care, even the oldest patients that are suffering from joint pain can be treated.
Okay, really great information. And there you have it, Fact versus Myth with Dr. Liebelt.